We now have data that looks at a group of patients who've used cannabis for a year versus a group of patients who haven't. And we see things like a 50% reduction in doctor visits, a 48% reduction in ER visits, 13% reduction in absenteeism, and is it a 56% reduction in prescription medication? This is huge from whether it's you're an employer or a payer. This is really significant for the entire healthcare system. So for me, that surprised me even after sort of working in this industry for almost a decade.
What's up, guys? Welcome back to another episode of The Dime. I'm Brian Fields, and with me, as always, is Kellen Finney. And this week, we got very special guests, Emily Fisher and Dr. June Chin. Ladies, thanks for taking the time. How you doing today?
Really good. It's great to be here. Excited to be here and doing really great.
Thank you for having us. We've been looking forward to this all week.
Yeah, us as well. Kellen, how are you doing?
Doing really well. Really excited to talk to Emily. Really excited to talk to Dr. Chin. I know that they earlier mentioned, we were chatting, that they both have a very fond spot in their heart for the West Coast. So I'm excited to kind of pull that out. How are you doing, Brian?
Yeah, I'm stoked. First off, that's a reach, and it's funny for you to put that out there.
Said that, though.
Yeah, I know.
We both used to be West Coast people. That was the words.
I think the part for me that's really exciting is, Emily, we got a chance to link up at Benziga a while back, and right away, Kellen and I were stoked with the opportunity to see what you were doing and then dive really deep. And I think it was difficult for us to wait, and we're really excited to kind of bring that to our listeners today. So before we dive in, we do have a little East Coast, West Coast battle. And ladies, we got to put you on the map. East Coast or West Coast, which one are you choosing?
East Coast for me.
Yeah, I would say East Coast. I'm a New Yorker. I grew up in the Bronx, so I'm still an East Coaster.
Let the record reflect. So before we dive in, can you give our listeners a little bit of background about yourself and kind of how you found your way to the cannabis space?
Sure. I'm happy to go first. So I founded Leafwell almost 5.5 years ago, but my cannabis journey started about 3 years before that. So I began working with medical cannabis patients in California early in 2016. Back then, there was no legal framework for cannabis in the UK at all. So when I was asked to go and work with medical cannabis patients, I had to be convinced, if I'm completely honest. I had to, they had to twist my arm a little bit. But then I got over there and I saw the impact cannabis had on like hundreds of people's lives. And, I was, I think it was after the first call I had with the patient, I couldn't believe this was the same. We were talking about the same thing that I had grown up hearing about. I also then became a cannabis patient myself. I had breast cancer at the age of 26 and had about 13 surgeries afterwards. So I used cannabis instead of pain medication. And, I can go into that probably at another time, but it was both my personal experience as a cannabis patient, as well as what I saw, the impact that cannabis had on many, many other patients that really inspired Leafwell. And we set out 5.5 years ago to increase access, education, and research. I realized as a patient that we were just scratching the surface in terms of what this plant could do for people, for patients, in terms of giving them options to support their healing, and that we needed to increase access, we needed to increase education, and we had to increase research. As a patient specifically, particularly because I come into this through the lens of a patient, I understand that if you go off the sort of the hospital care plan or the care plan your doctor's given you, you're going to be digging into that research. Research is essential. You're going to be concerned about contraindications. What are the side effects of this if you're already, trying to heal yourself? And so these are the three pillars that we set out with 5.5 years ago, and they stand true today. And really excited to share more about how we've evolved as an organization. But that is how I come into cannabis.
Dr. Chin?
Yeah, so I also started as a patient. I grew up in the East Coast, but I went to medical school in California, in San Francisco. So shortly after medical cannabis was legalized there, I was a patient before I became a physician. I have an autoimmune disease of the spine called ankylosing spondylitis, which is basically your spine starts to deteriorate and fuse on itself. So you lose mobility, and most patients with AS go on disability quite early. And I happened to be at the right place at the right time. One of my attendings, who was an HIV and AIDS physician, was treating his patients with marijuana at the time, and he knew that I had AS. And he basically said, "Look, if you are going to continue on this route, you're not going to finish medical school. You're probably going to hit disability quite early, but you should try something called marijuana." And that changed the trajectory of my life. When I tried it and I saw the patients with HIV and AIDS that he was helping, I decided to dedicate my career in helping patients understand the plant and understand how to integrate it with their conventional medication and healthcare so that they can combine the best of both worlds.
I love it. And one of the biggest challenges that I'm envisioning is that when you're starting off on that journey, trying to understand the capabilities and the medical research of the plant, where's the first step? There's so much to cover and so much unknown in front of us. Is it a targeted approach? Do you understand a condition and go from there? Or is it more, we're going to put everything in categories and try to hit it one at a time?
I think the beauty of alternative medicine and natural medicine is that it helps patients become more active in their healthcare journey. So, like myself and like Emily, when you go to your health provider and they don't understand something, you really need to look at the research and you need to be educated about other ways that you can apply alternative medicine. And I think that is what Leafwell has done in the last 5 years, is it helps patients from all walks of life. Whether you are cannabis naive and you have no idea how and if cannabis can help you, or if you're more experienced, we can help give you the tools so that you can talk to your health provider in a more educated way.
Absolutely. And maybe what I'll also add to that is that we have been in a position, so we really set out initially just to sort of ask and learn, find out from people, why are you wanting to use cannabis? Have you used cannabis before? How long have you used cannabis? What medication are you on? The severity of your symptoms. We set out and just to listen and to collect that patient-reported feedback. But now we're in a position where we're operational in 38 states. We see over 1 million people on our website on a monthly basis. We facilitate over 15,000 patients across all of these different jurisdictions. And people's experience of cannabis is largely shaped by where they sit in the world, which state they're in. And so we've got this really interesting view across all of these different jurisdictions. And we've been able to organize that data and not just see those patients once, but follow up with them on a monthly basis. And, our platform is both a cannabis care platform. So we've built our own EMR, EHR, so electronic medical records. So we're collecting thousands and thousands of bits of data from all of these jurisdictions and learning ourselves, understanding this plant better as a medicine, and then also publishing that research.
Do you notice, is there like a difference from state to state, jurisdiction to jurisdiction, from like what you guys can provide in terms of like what's available to the consumer or the patient for like a medical purpose perspective, right? Like they may have this disease that allows them to be treated with cannabis in, say, state A, but that's not the case in state B. Do you guys come across those kind of situations?
Absolutely. Yeah, and I'll jump in, but I'm sure Dr. June has more to add to this. But every state has its own qualifying conditions. You have, your own, there's different products in each market. So we're absolutely, and of course people move more than ever now. So yes, we're sort of coming up against that and helping patients navigate that on a daily basis.
But I would also say, because we have over 100 providers in 30 different specialties, let's say you are in Florida, for example, and, you see a rheumatologist and they're like, oh, well, your autoimmune condition, your lupus is not a qualifying condition. However, when you start talking to a health provider that understands integrative cannabis care, they're like, well, you know what? You have chronic pain and inflammation, and that is a qualifying condition. So while lupus might not be, we can put you under chronic pain. Or if you see a Parkinson's patient and they're in the South and Parkinson's is not a qualifying condition, but nerve pain is, myalgias, muscle pain is, then we can integrate that and put that into your qualifying condition into the electronic medical record. Also, what is wonderful about Leafwell is that we have hundreds and thousands of data points. So you're not just getting this information from one rheumatologist that is treating MS, but we are collecting data from hundreds of thousands of encounters from a woman who's 32 years old with rheumatoid arthritis to maybe someone that's 76-year-old. What type of products work? What type of products work in the daytime versus the nighttime? What types of products work with rheumatology care plus GYN? Maybe you have women's health issues that are combined with your autoimmune disease. So think about all these data points put together. This is the robust network that we're working with here at Leafwell.
The data points are staggering. That's a massive amount of data points. And before we go into that, I want to ask, but state by state, they've got all these different qualifying issues. Doesn't that make it worse for the patients? And wouldn't it be better for everybody if we just said, okay, cannabis can help with X, Y, and Z, and it doesn't matter if you live in New Jersey, New York, or Maryland, you still have the same condition. And this product, which we know can help you, should help you whether you live in state 1, 2, or 3.
I think I would say every state has its own political ecosystem and culture. So I would even also want to push and say every provider has their own cultural biases, and it's important, for providers to have cultural competence to understand the ecosystem in which they work with. And when you're talking about plant medicine with such a deep, complicated background of prohibition, it brings in another fold. So I actually don't think it's easy to just give a blanket statement all across all states and say, these are the conditions that work. It might not work for that state's ecosystem. But when you have a health provider that understands the nuances of that community, the process will be that much easier. And that's what Leafwell provides.
Yeah, I agree. And I would add that it makes it more complicated for the patient. It also really, I think, it creates blockers for the industry as a whole. We are still scratching the surface in terms of what we know about this plant and the science behind it and its utility as a medicine. And part of that is this sort of patchwork of regulations and patchwork of realities, essentially. It still amazes me. Obviously, I've been in this industry now for 8 years, and things have moved, so far in that time. I remember when I first got into it, finding a provider was really difficult. And I'd hear stories of people walking down a dark alley to go down this cave to find a provider who would certify them or would talk them through how to use cannabis, and then half the time they'd have really bad experiences. Now we and other organizations have made that much easier. It's seamless, but still in today's age, this is still largely inaccessible for a lot of people. They find it complicated. There's still a lack of awareness, a lack of education. So it just, every time I frequently do go out and speak to patients and people outside of the cannabis industry, I realize how much more work we still have to do.
I think another piece of this is insurance, right? Do you guys help kind of navigate that whole world for the patients in terms of information they need to then communicate with their insurance provider to actually get coverage? Or is that even possible, right? I would imagine that some of this should be covered from a medical perspective for treatments. What is that whole card like?
When you see a trusted provider, for Leafwell, we've long been out of network providers. Patients can always submit the receipt from Leafwell as an out-of-network, see if they have out-of-network coverage. But we are actually working with employers now to bring this integrative care into their employee benefit plans. And that makes it very easy for commercial payers. For example, we partner with Meritain, Aetna, and Blue Cross Blue Shield to see the data, see that it works for, let's say, certain demographics of patients, certain ailments, certain chronic diseases, how much prescription is being saved, prescription medicine costs, how much ER visits are being decreased, or other pharmaceutical medications that cause dependence, and we can back this data so that the insurance companies can understand that it will help their bottom line, not just patients.
We're very much working towards a future where cannabis will be reimbursed. And I believe we are very much at the cutting edge in terms of the work that we're doing with employers. That is the first step towards a future where the medicine will be reimbursed. And I think that truly is when we can unlock, and unlock this as an option for so many more people. If you think about even in sort of the context of an employer, we know that a big reason why a lot of people are scared to use cannabis is because of workplace repercussions. And so now if you've got employers saying to people, actually, this is an option for you and you should try it as an alternative to your prescription medication, that really changes the conversation and makes it an option for those people. So this is the first step in that journey, and we're definitely pushing towards that future.
And I would say on the other side of the coin, because more states are rolling into adult use dispensaries and not just medical, you have increased access. So employers are realizing whether they're for cannabis or against cannabis, it's not for them to say their employees are self-medicating. There's a survey we did in New York that showed that over 50% of employees self-medicate, right? Maybe they're using the gummies for sleep, maybe they're using anxiety, but employers, especially those forward-thinking employers, and kudos to them, are really getting ahead of this. And they're saying, you know what, we have to just support our employees where they're at. We have an obligation to make sure that the workplace is drug-free and safe. We need to make sure that our 5th grade math teacher didn't come to class taking the wrong gummy and took a sleep gummy for the daytime and they need to call out sick. So we need to get in front of this and support our employees with an integrative cannabis care benefit. Just like you would with vision and dental, and you carve out a benefit enhancement. We are working with employers to carve out an integrative cannabis benefit.
That's such a difficult balance, because even here in New York, we've had so many towns opt out of adult use cannabis, mainly based on the fact that they just are uneducated. So it starts with probably the data like your team has, publishing that and consistently reinforcing the message that cannabis is not the boogeyman. It has medicinal benefits, and here's the research. But changing hearts and minds, especially one as long as prohibition, isn't as effortless as just producing the data. Hey, scary Karen, read this and change your mind. It's harder than that. So how does your team handle that, knowing that the hill isn't just one foot in front of the other? It is as steep as possible.
Education, I'll say this, education is critical, but education alone isn't going to move the needle. And I think what we saw in the data and what, the conversations that we're having with employers now is this isn't just going to improve health outcomes of your workforce. This is going to save you a significant amount of money. We have seen a significant drop in healthcare utilization rates, medication, prescription medication, absenteeism. These are things that truly impact the bottom line of employers. And so when we can show that data, that's really powerful, and that does move the needle.
Yeah, I would imagine the financial aspect of that is very intriguing for them. But is that, like, from the insurance standpoint, is there pushback based on maybe some of the other participants, like the big pharma who's in their pocket saying, hey, like, cannabis is not good? Do you guys ever find any of those influences affecting the conversations that might not be publicly saying, but might be on the back end saying, hey, we don't want cannabis to be a medicinally accepted principle?
The pushback that I've seen clinically is the standardization, right? Is really making sure that you are getting a product that is third-party tested and standardized and at a regulated dispensary. And when patients are up and down and they can't get regulated and affordable medicine, cannabis medicine, that is the pushback that I've seen. But when we show I would say institutions, the data that we have, let's look at X, Y, and Z prescription medications. Let's look at ER visits. Let's look at physical therapy sessions. Let's look at how many times you've gone to the doctor. A cancer patient, how many times you've gone to the ER for nausea, dehydration, and vomiting. That is very clear, and we can't argue with that. But it's all really on the other side is what kind of medicine is a patient taking? Medical cannabis is a patient taking. Where are they getting it from? Are they getting it from their grandson? Are they getting it from a smoke shop, a gas station, or are they getting it from a reputable dispensary? And that's what we help patients do. We connect them with dispensaries that are regulated, and the dispensaries that we connect them with have a 15% discount through the Leafwell network. And Emily, maybe you can talk about that.
Yes, yeah, absolutely. So at the moment, with the work that we're doing with employers, the care piece of this is covered. So people can see a healthcare provider on the Leafwell platform. As Dr. June said, we have over 30 different medical specialties, so they're able to connect with any of those medical specialists, understand how cannabis can be incorporated in their treatment plan, receive a personalized guidance, and all of that is covered by insurance. But the actual reimbursement for medicine itself doesn't exist today. So as a proxy for that, we have negotiated with all of our dispensary partners. We work with over 700, a discount. It's actually up to 30, so it's 15% stackable discount up to 30%. So even though cannabis itself isn't covered today, employees, members who access it through Leafwell can save upwards of $500 a year. So it is a significant saving, and yeah, employers really appreciate that.
How do dispensaries qualify for this program? Do they have to reach out to you guys, or do you guys reach out to them? Do you have a list? How does that work?
we work with, obviously there's still a lot of dispensaries we don't work with, but yeah, reach out to us.
Shout them out.
But dispensaries will qualify if they are a legal, regulated dispensary. There's obviously a lot of consumers, cannabis consumers. They're growing every day, but there is a far bigger market out there of the kind of curious. And we talk about this all the time. There's probably double the number of people, an estimated double the number of cannabis consumers, kind of curious as they are consumers. And so I think there's opportunity for all dispensaries to really partner with Leafwell, and something like getting this into employers really does unlock the kind of curious.
I was at a health fair, an employee benefit health fair, and I'll give you an example. One of the women who's an administrator for the city, a civil worker, she loved this employee benefit. And she said, actually, my dependents, my son is covered under my employee benefits, under this health plan. Can he get to the dispensary and get a discount? Can we see a Leafwell provider? Because he's in college, and frankly, he uses a lot of cannabis. I don't know if he's using too much, but he says it helps with him with ADHD. So think about the dependence of these healthcare plans, right? So where you're not just reaching the canna curious, but you're also reaching the whole family as a whole. This is 360 care, integrative care for the entire family under that employee benefit.
Who came up with the idea, and how does that that sounds awesome. You know what I mean? How did you guys finagle all of that?
I just think this is the natural progression for cannabis therapeutics. So whether you have a medical card or not, Leafwell started with, medical certifications for access. But as this complex industry evolves and we have adult use dispensaries, we have increased access, this is really about therapeutic wellness and therapeutic care. So I think it's a natural, it's been a natural evolution.
Agreed. And I would say this, that the future of therapeutic cannabis or medical cannabis that's very different to what we understand as medical versus recreational, or medical versus AU, which is really a legal construct. This is not the reality from a consumer or from a patient perspective. There's, I've heard all sorts of estimates, but, people estimate that about 80% of people that use cannabis are using it for some form of therapeutic outcome. And so if you can then say to these people, well, you can get your medicine or your care reimbursed, that's a huge incentive for people to use it, get the therapeutic guidance, and many more people to use it. Our vision for that is very different to what we're experiencing today.
I love it. And I can only imagine whiteboarding, okay, here's the goal. And then thinking the first step is who do we call to even start this process? Because it's not you can just pick up the phone and just start getting after it. It is a very difficult way to try to overcome a longstanding prohibition and then working through, because it's not the person that you need to isn't readily available. You have to fight through channels with consistent persistence. I tip my hat to you because that is not an easy fight. But Dr. Chin, I want to go back to you because before you were saying that providers want consistency in their product. And as we know, cannabis is a plant and has massive variability. So how does your team ensure that the data coming through allows the patients get that consistent product?
Well, that's the secret sauce, isn't it? Right. So the data, I mean, if you have a rheumatologist that's logging in from Florida versus a rheumatologist that's logging in from California or Ohio, because we have all this robust data, because we have the electronic medical records, I would say a patient coming into the Leafwell network doesn't just have one provider as their specialist. They have multiple providers. They have multiple hundreds and thousands of experience and encounters of data points at their fingertips. And that's part of our technology and our data.
Can we talk about some of the research too? Can you share some of what you're doing or what's on the horizon, just to give our listeners like a breath of like the current aspects and what we think the future holds?
Oh my goodness. So Dr. Doucette, our senior research director, is from Johns Hopkins. He's an epidemiologist and public health specialist, and he's on his seventh paper with us, seventh published peer review paper, Emily. I mean, it's amazing. We have so much. We have data on how telemedicine increases access to care, especially for the underinsured and underserved populations in Pennsylvania. We looked at rural areas that don't have a GYN for 2 hours. You have to travel 2 hours to see a GYN specialist. You're able to see telemedicine specialists and how that decreases healthcare utilization costs. Then we have another research on PTSD and benzos and how medical cannabis can decrease the usage of benzodiazepines and actually decrease costs of care for PTSD patients. What other studies are we talking about, Emily? I mean, I'd love to put a link actually in your show notes so that patients can take a look at what we have.
Are there any areas that have surprised or shocked you from some of the research where maybe you went in assuming one thing and then turns out completely different?
Yeah, Cal, for me, I'm not a scientist. I always say, I'm really the layman's, the patient, the consumer. It's really the economic impact of this that surprised me. We knew that cannabis, I've known cannabis as medicine for a long time. And, there's people's understanding of it it's very much anecdotal. But we now have data that looks at a group of patients who've used cannabis for a year versus a group of patients who haven't. And we see things like a 50% reduction in doctor visits, a 48% reduction in ER visits, 13% reduction in absenteeism, and is it a 56% reduction in prescription medication. This is huge. Like from a whether it's you're an employer or a payer, this is really significant for the entire healthcare system. So for me, that surprised me even after sort of working in this industry for almost a decade.
Staggering. If I gave you a magic wand and asked ethics or money is no obstacle, what research are you doing?
I would say women's health. I think women's health research and cannabis medicine is what we would study. Whether it's breast cancer, post-surgical care, pelvic pain, that is what I would like to see more of.
Does the endocannabinoid system have any influence on like the next steps for additional providers who maybe are a little more skeptical now to become more comfortable with recommending cannabis in the future?
That's part of, what Leafwell stands for. We do webinars. We are in conferences where there's other health providers. I'm doing one actually in New York, in Westchester, in May. And these are health providers from physical medicine rehabilitation, orthopedic surgeons. I think getting this education into the hands of providers will only increase access because you'll have cross referral. So maybe you're working for a hospital or a cancer center that says, you know what, we're really not quite ready because of the federal legalities to recommend cannabis care, but they have no problem referring to us as the integrative cannabis specialist, and then we will co-collaborate and work with your local doctor. And this is what, the employee benefits, this is what the insurance will cover. It's called collaborative care. There is a code for it under the insurance claim form, and we will make sure that you get the cannabis specialist that you need in the specialty that you need, whether it's rheumatology, GYN, or oncology, and then we will communicate with your local doctor to make sure that you get the healthcare that you need locally.
I have a question that might pivot the whole conversation, but so 1996, right? California announces like this medical program, right? We have medical cannabis. Colorado legalizes adult use cannabis in 2014, right? So it's been 11 years. What is it going to take to get like the American board that like certifies doctors to like actually allow the endocannabinoid system to be like taught in medical school? You know what I mean? Like there's all of these conversations, and I'm not like pointing a finger at anyone. I'm just like curious, right? Because like we've seen this research for 20 plus years, right? We have like 30 states in America that have adult use. Medical use is profound. Like there's a lot of statistics that show the benefits. Like how do we actually get the like board that certifies doctors and certifies what's taught in medical school to actually start like encompassing this information?
Rescheduling.
Is that what it takes? Literally is rescheduling from HHS. So like we're right on the cusp of it actually being taught. So that's another huge benefit for the rescheduling that people never talk about. How come it's not? Why don't we talk about that more? Like, why don't we lead with that? Everyone's like taxes, right?
I think there are a lot of different interests at play.
Yeah.
Right.
And I'll provide maybe a slightly different perspective because I'm here in London and I get to see what's happening in Europe and listen to the discussions that are happening over here, and you sort of think, well, look at the US. There's 4 million patients. There's a ton of evidence that this is working, and Europe is known to be much more conservative with their sort of protocols and but what they need, and I think what the industry honestly needs as a whole, is more research, more data, and that is another area that is really going to benefit from rescheduling. The investment into research will increase significantly, and I think that's what we need. We need to follow the science. That's what's going to I'm not a doctor, but I'm married to one, and I'm surrounded by doctors, and I think I'm speak to very skeptical doctors, as well as those who are really for this. And what's going to change their minds is research, the science.
It's such a hard balance, exactly like you were saying, Kellen. It's like, why don't we lead with that? Well, it's not the most maybe popular topic, but it might be the most influential one. Exactly like you were saying, Emily. If we have more research, then maybe hearts and minds will change, and then we can start teaching this. We can start understanding more, and then we can start offering these products consistently more based on the research, which again is like a loop challenge. Which, what do you put first? How does that work? It's nearly impossible to figure out. To kind of go back to the data question that I really want to ask about is your team utilizing AI at all in order to understand additional areas that maybe haven't internally been considered, but based on the data findings, maybe should be explored a little further?
Yeah, absolutely. We're a technology and data company, so we're absolutely taking advantage of new technologies, including AI, to not only understand what our data says, but to organize the existing body of research out there. So, yeah, absolutely.
Anything you could share with it?
Well, again, when you want to get cannabis reimbursed, it's back to the sort of the point that Dr. June made earlier. In order to get cannabis reimbursed as a medicine, we believe you have to get standardization. We have to better understand what product is good for whom. And it's complicated. Cannabis is complicated. Patients are using it for lots of different conditions. So we're definitely using AI to help, in addition to the clinical input that we're collecting from the providers on our platform, the patient-reported outcomes, to really refine those personalized care plans.
And as you become an in-network dispensary and partner with us, we're able to collect that at the back end as well. What are consumers and patients purchasing? What is the COA data that they're purchasing with? And how does that close the loop and inform their healthcare utilization?
Is it strain and terpene specific? Does those vary? How does that all work together?
Yeah, everything matters. All of the data points matter.
No, I mean, I think, I think your question is specifically what product is good for a specific outcome. And that's the holy grail. And that's definitely what we're working towards.
Yeah, because I'm just envisioning how complicated and how difficult that is in knowing, let's say, a product for me affects me one way and a product for Kellen or you affects you guys completely different. And then utilizing it for medicinal purposes is such a key alignment where exactly like you were saying before, Dr. Chin, is like if we give it to a seventh grade teacher and they use it for sleep and then they're up all night, guess what? Not going to be good at their job the next day because the product didn't work. So that is such a difficult balance.
And on top of that, that seventh grade teacher could be on Wellbutrin and you could be on Zoloft plus, Ritalin. What does that play into it? So this is the secret sauce. This is where all the data points matter.
Is there any because this would all be teased out through a robust clinical trial, right? Is there any plans on a large clinical trial for these kind of detailed studies in the future? Or is that going to require rescheduling as well?
I think that requires rescheduling, but also I think that Leafwell is a position to be a CRO. So I know Dr. Doucette works with cancer centers. We also, work with other universities because we have so many patients come through, because we have all this robust data. A cancer center, for example, can say, you know what, I'm doing I'm studying women's cancer, ovarian cancer, and I would love to target women between the ages of 37 and 45, and then these exclusions and these inclusions. We are able to help other organizations formulate a research protocol.
So they could potentially utilize your ladies' data to tease out potential targets to kind of build a clinical trial around, being hey, we noticed with this data that people in this age group who maybe have these symptoms have benefited tremendously. I think that it's valuable to research this topic more through a clinical trial. That's kind of the means they could utilize the information that you guys are aggregating.
Not only the data, but they could use us for recruitment purposes as well.
Oh, I didn't even think
right? Because we see 15,000 patients a month.
A lot of people.
We're in 37, 38 states, I believe.
38 states and growing. I mean, we're expecting to be seeing a lot more patients this time next year.
I feel like I'm going to make a silly statement by asking the government to logically make decisions, but we'll go for it. If the government is looking to get a better medicinal understanding of the plant, wouldn't then it make logical sense for them to recruit your team to help with those elements in order to better understand these capabilities, and then they can feel more confident that these risk scheduling decisions are based on true data science?
We would love to work with regulators and government entities. I think, I'm the vice chair of the Cannabis Advisory Board for the New York State OCM. And I think we need all the help we can get.
And I think as we move towards rescheduling, there is a growing interest in collaboration. In the past, these data sets have been very much siloed and not connected, and that's been part of the problem. So we as Gina said, we'd love to, and we are already starting to, speak to organizations and see how we can collaborate to move this forward.
And I think regulators are open with it. I mean, before Kentucky came on board, Emily, right? Kentucky reached out to us and, asked us what we thought and how the other states were rolling out. And we're talking at CANRA in a few months. We're doing a presentation at CANRA, which is, I think regulators want to understand what the market is, and also not just from a clinical trial perspective, but what is the observational data? What are the cultural nuances in different states?
And, I don't think it's just rescheduling. I think it's also where the industry is as well. The industry is struggling in many ways. And, we've got to a point where a lot of the retailers are fighting over the same consumers, and we've got to unlock more consumers, and we can. There are 100 million people that are looking at cannabis. They're interested in it. They're thinking about, maybe I should try this as an option. So we can, and I think the industry is also starting to realize we've got to go back to education. We've got to go back to speaking to people who aren't already consumers. We can't just be focused on, the people who are already consumers, the people who are, adult use consumers. In fact, many of them are looking for a therapeutic outcome. So if you give them that support, if you optimize their cannabis experience, maybe they'll spend more. Maybe they'll, bring new customers to you. So I think it's actually been interesting to watch that even between this year and last year. I think we are, the conversations we're having tells me that people are really ready to refocus on the therapeutic outcomes of cannabis.
1 year from now, what has changed?
I mean, I believe that cannabis being reimbursed as a medicine is actually not so far in the future. I think we're very close. So I don't know if it's going to be a year, but I would love it to be. And I think when that happens, a whole, domino effect happens. That's a big incentive for people to try cannabis, to become a patient. I think there's a refocus on medical. I think that becomes a lot more aligned with what's happening over here in Europe. So that's what I'm seeing, and certainly for us as an organization, everything that we're doing, our mission, our pillars of access, education, and research only become more relevant and to everyone.
Are there any areas that the science has, let's say, disappointed or not been successful for cannabis that maybe a lot of people assume naturally that cannabis can help here?
I think that people underestimate the benefits of integrating cannabis. It's not a one size fits all, and it's not going to cure it all if you're just using cannabis alone. I think the important thing that it is okay. It's not good drug, bad drug. Like pharmaceutical is bad, prescription medication is bad, and cannabis is good. I'm going all natural. I think it is okay to integrate both, and you can get the best of both worlds.
And I'm just like nodding and personally feel, deeply care about this point, because as a patient, integrative care is good medicine. It is what medicine should be. There shouldn't be this good, bad. Are you going to go alternative or are you going to go medical? These are all tools for you as a patient, as a consumer. And I'm so passionate about making as much available to people as possible.
I love it. Those are great answers. All right, last question. If you could put anything on a billboard, metaphorically speaking, to get a message to billions of people, it could be an image, a quote, a word, or something that inspired you, what would it be?
Can you answer this one? I think you might want to cut this one out, but I saw something actually that went up on a billboard in the UK like a year ago or so, and it said all of us have an endocannabinoid system. But what I love about that and that kind of messaging on a billboard is it normalizes this. It makes this, it sort of knocks down those barriers. It makes this really personal to everyone. And so I would love to have more messaging, more advertising like that in terms of, that's it.
That was a good answer.
That's an amazing answer. So, ladies, for our listeners, they want to get in touch, they want to learn more, and for our employers that want to explore the program, where can they find you?
Leafwell.com. Come to our website. We're actually updating our website, so in a few weeks it's gonna look very different, and there's a lot happening that's not necessarily visible on our website today, but it will be in a few weeks. But get in touch. We don't ever stop. We're open 7 days a week from 8 a.m. to 8 p.m. in every time zone in the US. And then we have a European team. So when you guys go to sleep, we're awake again. So get in touch. We're here for you.
I love it. Thanks for taking the time. This was a lot of fun.
Thank you.